Okay, we are live now. So we just wait to see if people are connecting. I think we can start.
Okay.
Okay, all
Mhm.
right. So, good evening, everyone.
Hello.
Hello. So, I'm just trying to see. Okay, perfect. Okay, so good evening, everyone. Breast cancer is now the most common cancer diagnosed worldwide and here in the UAE.
Yeah, that's our
Sorry,
statistics.
there was a technical, yeah, now it's fine. Can you hear me?
Yes, perfectly.
All right, okay. So, good evening, everyone. The breast cancer is the most common cancer diagnosed worldwide and here in the UAE. It is also the top causes of death related to cancer. That's why here in our call, we would like to emphasize that the breast cancer awareness doesn't stop with the end of the month of October. It's also a conversation that should continue all over the year. Tonight, I am highly honored to be joined by Dr. Madina Khadartseva. We will be talking about breast cancer risk factors. We will talk also about self examination, about the treatment, and about care after the treatment. We will also talk about the importance of the mental and emotional support during this journey. So, just before we start, allow me to introduce myself. My name is Yasmina Shamimi. I am a resilience coach. I am founder of the program Fear No More. Uh, my journey with resilience started when I was 10 years old, when my late father was diagnosed with a brain tumor. During this period of 12 years, this period taught me to be empathic and to be resilient, and also to find hope in the darkness. In 2023, March 2023, it was my turning point where I was diagnosed with the kidney cancer. And at that time, I was thinking about my life as I found that I have a second life chance to live. And I really wanted to do something very valuable with that. So that's why I moved from being a CFO to be a coach, full time coach, and to work on resilience with women dealing with health issues. And I founded the program Fear No More, which is a program developed for women dealing with health issues to help them manage the stress and overcome the fear, find inner peace and inner strength. So today, I would like to introduce Dr. Madina. Dr. Madina Khadartseva is a doctor with 11 years experience into interventional breast radiologist, and she is expertise in clinical practice, telemedicine, and medical research. She is also the founder and the CEO of Delegata, a medical concierge and medical tourism company here in the UAE. Dr.
Thank you
Medina
for
has
your kind introduction, dear Yasmina.
thank
Hello,
you.
everyone, and thank you for joining this important discussion about breast cancer. Today, our goal is to empower ourselves and everyone with knowledge that could save lives. So, we are providing a simple yet comprehensive understanding of breast cancer, covering, as you mentioned, risk factors, importance of screening, how treatment effectiveness is assessed, and the significance of follow up care after treatment, along with emotional support. So let's start with the risk factors, I think.
Thank you, Dr. Madina. Yeah, before we start with the main discussion, could you please tell us a little bit about you and what inspired you to be in this wonderful journey?
So, as you mentioned in introduction, I'm breast radiologist. I dealt with ladies who came just for screening or who found something in their breast, and it was really challenging to give them diagnosis. So I'm the first person who tells the patient that she has breast cancer. After my
Oh,
consultation and my diagnostic procedures, then patient goes for treatment. And on this step, I'm the one, very often women were asking me where to go, which surgeon to choose, which chemotherapy to prefer, hospital, to stay in that hospital that I was working in or some other place. And at that moment, I realized that for patients who are for people who are not in healthcare, for them this is so challenging to choose a proper doctor, proper exams, equipment to be examined with. And I realized that it will be very important and helpful for people to navigate them through
amazing.
this healthcare journey. So that's how idea of opening Delegata company appeared, especially here in Dubai. I know many recently relocated people. They face this challenge to find good doctors, good facilities for their kids, for themselves, and that's what I'm doing here. And I'm so happy. Apart from breast cancer, which I still continue to do, I consult my patients in Russia, but here in Dubai, I do much more in all spheres of healthcare.
Okay, amazing. And your services at Delegata are for everyone or only for people relocating here from Russia to Dubai?
No, actually, it's for everyone. But one of our benefits is that we speak Russian, and so
Yes,
for Russians, that's easier to speak the same language with the doctors, and for someone who can explain them complicated medical terms. But also
yes.
with everyone who speaks English, of course.
Of course. Okay. Thank you. Thank you, Dr. Madina, for being here with us. So let's start with our topic, with breast cancer topic. So if we want to explain what is the breast cancer exactly with a very simple word, what would you say, Dr.
Yes,
Madina?
in a very simple words, breast cancer, as any other cancer, it's a pathological cells that normally all cells in our body they have their time life. They die after some time, but cancer
Okay.
cells they don't die when they have to. They live much longer and they um, um reproduce, so that's the difference. They reproduce a lot and they don't die. And that's how cancer grows and develops, migrates to lymph nodes, to other body parts, organs. uh, there are many factors around it. What causes normal cell to become abnormal, to get
So
these
happy.
features for living longer and to start reproducing quickly? It will take much more than one webinar to explain, but in simple words, cancer is um, former normal cell which mutated in abnormal cell, let's say
Yeah.
so.
Yeah.
And there are many, if we speak about breast cancer, there are few risk factors.
Mm-hmm.
uh, we should mention that breast cancer can affect anyone, any women and even men can
Yeah.
develop breast cancer during their lifetime, but there are some risk factors that can increase likelihood of developing it. So, and
Yeah.
these risk factors, they are non-modifiable and modifiable. If we
o-
speak about non-modifiable risk factors, well, the main is gender. As we know, women are far more likely to develop breast cancer than men.
Yeah. Definitely.
Then it's age. Risk increases with age, particularly after 50. Also, genetics impacts a lot. We know mutation in genes like BRCA1 and 2 significantly increase risk. These genes, a few years back, they became popular thanks to Angelina Jolie because she's the
She.
most popular carrier of these mutated genes. And I'm
Yeah.
so happy, I'm so grateful to her and in general to all celebrities who speak about their health issues because this is very like a good trigger for all other people in the world to go and to check themselves.
Yeah. Exactly.
Um, yeah,
And
so mhm,
so you said non-modifiable and there is modifiable, right? So what are
correct.
the other? Yeah. What are the?
Modifiable risk factors, yes. Oh, let me finish with non-modifiable
Yes.
mutations in genes. The next one is family history. If
Mhm.
a lady knows that in her family, women, her mom, her grandmom, aunt, sister had breast cancer in early age before menopause, so this means that this lady has a high risk of breast cancer. Sometimes we even don't find mutated genes, but still this strong family history of young breast or ovarian cancer in the family
Family.
indicates us a high risk in this lady. Then breast dense tissue is also a risk factor as this makes hard to detect tumor on mammograms.
Yeah.
So for ladies with dense breast tissue, we also have special approach as for higher risk group. And then
Okay.
if we start to talk about modifiable risk factors, number one is lifestyle. So healthy lifestyle is avoiding smoking, alcohol, and exercise as much as possible is the number one
Mm.
um, preventive measure for breast cancer.
Okay.
So we know ladies, even those who have high risk factors like gene mutations, but if they have very healthy lifestyle, they can not develop breast cancer. So the
Mm.
other modifiable risk factor is weight. Being overweight after menopause especially can rise estrogen levels,
Mm.
which are fueling certain breast cancer types. Then it's so we also can modify our weight. That's a perfect opportunity to decrease risk factors. And
Factors.
the last one is our reproductive history. Statistics says that those ladies who had children later after 30 or
Yeah.
did not have children at all or never breastfed in their lives, they have a bit higher breast cancer accidence rate.
Amazing. Okay. Thank you, Dr. Medina. So we can capture that we have non-modifiable factors and we have modifiable factors. And we can see you mentioned that the women are most likely to get breast cancer than men. Is there any reason for that? I know that the answer could be obvious, but
Uh,
what makes
the
the
reason
cancer
for that,
to?
yes, in general, women have much more tissue from which cancer can develop. Also, we
Mm,
have much higher levels of estrogen and progesterone, and these hormones are also they are fueling cancer cells. And because of that, cancer can grow higher. By the way, we should mention also hormone replacement therapy. If someone takes it for a long term, for example, more than 10 years, it also contributes to the whole um, breast cancer risk. It
Oh.
elevates a bit, yeah. So
What is
that's
this
why
hormone?
women hormone
Hormone.
replacement therapy. This kind of therapy which premenopausal or menopausal women are taking. For
Okay.
example, some can have very severe symptoms during menopause, very bad quality of life during menopause, and this hormone replacement therapy helps them a lot. It really saves them because some ladies feel depressed, they don't sleep, they have very
Mm,
bad mood changes because of
exactly.
menopausal changes in the body.
Okay, so this hormone then that they are taking, if they are taking for a long period, it can
Yeah.
cause the breast cancer. That's why we can say that also breast cancer is coming at an advanced age, even though actually we can see that people, I mean, some ladies, let's say, they have the breast cancer even at an early stage age.
Yes, it happens, but luckily not often. We have cases when very young women, around 20s even,
Yeah.
have breast cancer, but this these those are rare cases. Yes, we know about them, but if we take the whole breast cancer patients, uh, around half of them are older than 40, 45 years old.
Yeah, 40 to 45 years old. So that's why, exactly. So we were talking about the lifestyle.
Mhm.
You mentioned, doctor, that we have, I mean, people, they have to stop smoking, alcohol, and exercising. Is there any other lifestyle, any changes that we can adopt in our life to minimize this risk of getting breast cancer?
Well, I would say those are the main factors that we can affect, influence. Uh, for example, good that you mentioned smoking and alcohol because everyone knows that smoking causes lung cancer, but not everyone knows that it's also a risk factor for breast cancer and for some other cancers as well. For example, bladder cancer, colon cancer, and alcohol also by affecting liver. It causes increased levels of estrogen,
Yeah.
and as we already said, estrogen is one of hormones that feeds breast tumor.
Exactly, exactly. So, smoking and alcoholism and even less exercise are the common, let's say, factors for all the cancers, but also for the breast cancer because, like what you
Exactly.
mentioned, we didn't talk a lot about the breast cancer, and we can observe now that it is the most common diagnosed cancer worldwide and here in UAE, and it's
Yes,
also
among women.
yeah, and also is the main cause of death for
Mhm.
related to cancer. So it's something. So that's why this awareness should continue. Honestly, after this month of October, exactly. So thank you.
Yes.
So if
Unfortunately, even though breast cancer mortality dropped significantly, 40% less women nowadays die from breast cancer due to good diagnostics and improvement in treatment, even
yes,
though this is number one cancer cause for women. Yes.
exactly, exactly. We will come back to this. I mean, the improvement of the treatment and to explain also about an early stage diagnosis. But it's good to know that it's still, even if with this improvement, it's still the top cause for mortality. Now, if you want to talk about self-examination, what?
Breast self examination, yes, this is something that every woman or young girl should start with. But very important to mention that this is not replacement of medical exams,
Yes,
but it can help a woman to, first of all, get acquainted with her breast, to know how it is looks and feels normally. And if something appears, she will be the first one who can notice that. So that's why it is important at least once per month to practice breast self-examination. Um, there are many symptoms. Um, Actually, there are very nice, very, evident pictures. You can Google, everyone should Google and just see how breast changes look if it's cancer or something benign. For
okay.
example, number one symptom that ladies find during breast self examination is a lump.
Mm,
Luckily, 90% of lumps in breast, they are benign, but
okay.
anyway, it should be checked by a doctor. So if someone finds a lump in breast, men or women, this is the like number one reason to go, not to wait for something, but to go and to check
To check
with the with the
with the doctor.
gynecologist or breast radiologist. Yeah.
Exactly.
And normally we advise once per month. It's the
Mm-hmm.
same day or week. Usually it is the second week of the menstrual cycle. After
Okay.
shower, to have a look first in the mirror, how breasts look. Usually we all are a bit asymmetric, but if significant asymmetry appears, this also can be suspicious sign. Yes. Then a lady can start to check by her palm
Mm-hmm.
the whole breast, and also not to forget about armpit and nipple. So if
Unequal.
any changes, if something strange appears, not like this was with her since her childhood. For example, some ladies has inverted nipples during all her life. But if nipple was normal and then inverted, that can be suspicious sign.
Can
Not always it's like breast cancer, but it can be. So it also checked.
And you mentioned, Dr. Medina, that 90% of the lumps are benign. Okay.
Yes.
So usually when a woman will find some lumps in her breast, she will be a little bit scared, and she will, have some concern. How can we know? I mean, at least just before checking with the doctor, that this
Mhm.
one is something not to worry. I mean, yes, of course, we have to get it checked, but we don't have to worry about it. Is there any sign or anything that at least we can palpate?
Yes, most probably cancer is not painful. So, if this newly found lump is painful, most probably it's not a cancer.
Ah,
So,
okay.
the second thing can be if it is movable. So, it's like a ball under your fingers
Yeah.
or like a cherry, and it can move a little bit. So, it's not very. mm very, let's say, so cancer,
Fix.
it invades tissues around, and it's difficult to move a malignant tumor. But benign tumors, they are a bit uh, movable.
Movable.
Okay.
Ah, okay. So if they are movable, they might be a
So
cancer.
most probably, no. If they are movable, most probably it's a cyst or fibroadenoma, which
Okay.
are benign conditions. Yes.
Okay. So it's benign. Okay.
Yes. So cancer, it's not painful and it cannot be moved under the
Okay. And
fingers.
it's fixed. Let's say it's fixed. It's,
It's
I mean,
fixed, yes, with
it doesn't
surrounded
move.
tissues.
Yes.
Yeah, because it invades surrounded tissue.
Yeah, and also you spoke. You mentioned the dense tissue, the breast for the breast.
Mhm.
For some ladies, we have some ladies that they have this dense tissue. So how can they? You said you mentioned that it's specific way how we control or we monitor that. What is the
Yes.
difference between the normal and
Correct.
dense tissue?
So all women in the world are divided into four groups depending on their breast composition. Some ladies have more fat in their breasts, and some ladies have more fibroglandular tissue. Fibroglandular tissue, it is something that produces milk after childbirth. So this is normal tissue of breast, but cancer develops exactly from this part of breast, not from fat. And we know that if lady has all the breast consists of this fibroglandular tissue, it means that, well, again, statistically, lady has more chances for cancer to develop from some part of this fibroglandular tissue. And the second thing is that this normal tissue on mammograms can mask malignant tumors, because on mammograms this tissue looks as white areas, and cancer on mammograms also look as white lesion. So that's why white tumor on white background sometimes is very difficult to identify. So for
Okay.
these ladies, we have a perfect solution, which is breast MRI, which doesn't have this masking effect. There are special series of images where we remove normal tissue, and radiologist can see only something abnormal, which enhances contrast. And in this case, even small tumor, which is 5 millimeters in size, can be clearly seen.
See.
It
Okay.
shines like a star on a dark sky.
Okay. So any woman having this dense tissue
Breast,
breast
yes.
tissue
We
has to
already have European guidelines which say that breast MRI with contrast enhancement is much more effective and accurate for such ladies. And it's even economically better.
okay. And is it every year? She has to do it every year,
At
and
least every 2 years. But if
every
she
2 years.
also has a family history or
Yeah.
gene mutations, for example, so yeah, she should be checked every year. And
Every.
sometimes we also recommend to check breast every 6 months. So, for example, if ladies before 40, we
Mhm.
recommend to do breast MRI after 6 months ultrasound, then again MRI. If she is 40 and above, then we start to do mammography. And so after 40, the scheme for high risk ladies look like uh, mammography after 6 months, MRI. Then again, mammography after 6 months and MRI. That's how
Okay.
her screening algorithm looks like
For this kind of
for high
breast,
risk for
high,
high risk
high,
ladies.
and
Yes.
for the normal, what
For
is the
normal, it
approach?
depends. So for normal, everyone starts with mammography at 40, and then
Mhm.
her breast radiologist should inform her what is her breast density. So if breast density is C and D, means that she has lots of fibroglandular tissue, and mammography for her is not enough. This means that she should add either ultrasound or breast MRI to her screening.
Okay, so it should be. So talking about the screening right now, what are the screening options available for the woman? So you mentioned that there is the mammogram, there is the
So
MRI
mammogram, yes,
scan.
is our gold standard. This method is used for more than 5 decades already all over the world, and it, like we know this method very well. All the advantages, all the mortality decrease is due to using mammograms. But yes, it has some limitations, and one and the most uh, like but the worst limitation is that it's not for all ladies. As I mentioned, women with high breast density can miss cancer. Even
Yes.
2 centimeter size tumor can be missed on mammogram if she
Oh,
has lots of fibroglandular tissue.
okay.
But
So
the
there is,
good thing is that mammography is the only method that can identify microcalcifications. Some types of cancer, the only sign of them is specifically looking microcalcifications in breast.
So, and cannot be seen in the mammography.
Yes, only
Yeah,
mammography can show it.
yeah, okay, only the mammography can show it. And also there is ultrasound. What is the difference between the
Yes,
ultrasound and the
ultrasound
mammography?
is very different. Absolutely, another physics behind it, another science behind it. But in some cases, it's number one method. For example, for young ladies before 40 or for pregnant women, if, for example, a woman is pregnant and she's more than 40 years old, and if she feels something new in her breast, we start with ultrasound, even though
Oh,
she's more than 40. Yes. And also, ultrasound is the best, the most comfortable and convenient method for doing biopsy. If we can see some finding on the ultrasound, we prefer to do biopsy with ultrasound guidance.
ultrasound. Okay. Yeah, so there is ultrasound and mammography, okay,
And
and then the MRI in
yes,
really this high density breast tissues.
yes,
Okay,
breast MRI is, I think, in the next few years, it will also become a very wide use screening method.
yeah, okay. And you mentioned before that this MRI is ecologic. What do you mean by that?
So it doesn't use X-ray. It's harmless. We don't expose the woman to radiation as we do during mammography,
With mammography.
and it's very safe uh, because it should be mentioned that MRI doesn't have any radiation. It can be done for pregnant ladies, for kids even, because sometimes even doctors who are not radiologists, they um, don't understand difference between MRI and CT scans. So
Okay,
CT, yes, it is the X-ray method, and MRI, it's not.
okay.
So MRI is safe in these terms, but super informative for ladies from
Well,
high risk group.
hi. Okay, thank you. And what about the treatment? So let's say now you have a patient who came and you find out. So you said you are the first person to find on in radiology to find that the patient has cancer. So how is the journey of this person?
So this is a very difficult moment both for the patient and for the doctor, because some patients they receive this news. It's a huge stress for them. Some patients even deny for some time that they have it. But if we look from philosophical point of view, I always tell my patients, okay, we all have this opportunity to get breast cancer, but those are lucky I who find them on early stage. So you should be, yes, of course. Now it's a huge stress for you. I wish you never had this diagnosed, but well, as you have it, good that you have it at early stage. Good that you did screening every year and it helped you to identify it when it is very, very small.
Yeah,
So yeah, this is very difficult emotionally moment. But when woman starts to realize that yes, she did everything right, good that she didn't lose time.
time. Right.
Yeah, because
Yeah,
time is the
it's very
main
important.
thing with yes in
Yeah.
fighting
And,
cancer.
and when we say an early stage, what
Hmm.
does it mean? Is it we know that the cancer there is from stage one to I think stage four of
Yes, and we
yeah,
also even have zero stage breast cancer, which is
okay. So,
in situ. This means that cancer cells they did not spread out of the
that's
milk duct. So
okay.
this stage is the most
Uh,
favorable and needs less aggressive treatment. For example, we don't use chemotherapy for such cancers, only surgery, radiotherapy, and later on hormonal therapy.
hormonal. Okay. So there
Um,
is a stage zero, which is called early stage. What we put
yes.
under early
First
stage.
stage is also early stage. First stage means that the tumor is less than 2 centimeters. So
Okay.
this is also early stage, and usually this size of tumor can be uh, found only during screening. Those cancers that women identify by themselves during self-examination, usually they are already bigger than 2 centimeters. That's why we keep on telling women to go for breast screening every year. And I'm so grateful to you that you keep on telling that not only during Pink October, but also in late
Exactly, because
November. Yes.
exactly. I mean, it's really a cause of concern. So for concern, and really we have to pay attention, especially that uh, women. I mean, it's also touching the man, but it's very low percentage. It's like in 100 cases, it's 99 women and 1%. 1% is a man, but it's mostly touching a woman, and it's really scary. We have,
It
so I
is.
just want to invite the audience first to share with us their concern or their question if they have any question. Otherwise, we can carry on. Also, we have, so we said stage zero, stage one. Whenever we find a lumps, it could be a stage zero, it could be a stage one
Lump,
also,
yes, lump can be any stage.
any stage.
Uh, yes, depends on the size of the lump. For example, if lady has a big size of breast, she can identify tumor when it's rather big already. In smaller breasts, yes, it's easy to find even a small lump, but
Yeah,
again, it's like it's not guaranteed. So
it's
the best thing in screening, in regular screening. So when we have previous images, we have something to compare with, so we know
yes,
is it a new um, shade on the mammograms or it was before. And if we have previous images, uh,
compare.
accuracy of diagnostics is higher. That's why I always recommend for women, especially for those who are traveling from one country to another, always bring your images with you. If
Just
you are not sure if the next year you will come to the same clinic or hospital, please bring your images with you. And also because doctor next year doctor will need them.
we need them to compare exactly. And
Yes.
what about the ladies that they found some lumps, and
Mhm.
because they are scared, they don't
Yes.
go to see the doctor, or they go to see the doctor, but they don't do the follow up.
Correct. Yes. This is the worst, I don't know, thing that can happen. So many ladies, they are scared to hear bad news that this finding is something bad. So they just sit and wait for maybe it will go away by itself, or they start to use some alternative treatment, which usually never helps. And they just waste time. And I feel always so sorry for that, that time was missed. If we, because for last already 10 or 15 years, we can treat early stages 99% successfully.
That's, yeah,
Ladies with early stage breast cancer, they after complex treatment, surgery, systemic therapy, radiotherapy, they recover and they live long and happy life. But the main thing is to find tumor early when it hasn't spread to lymph nodes or to other organs.
also other organs.
Yeah,
And
even though it's difficult, yes, to go and to be checked and to talk to the doctor, but yes, I know it needs some braveness and courage, but
courage,
this
yes.
will save your life.
Exactly. Yeah, thank you. Thank you for mentioning that, Dr. Madina. And so let's say, so it's the stage two, three, and four. So they are an advanced stage. So
Three
what?
and four, yes. So stage three is when the tumor cells already reached axillary lymph nodes.
Okay.
Uh, yes, in this case, for example, when we have early stage breast cancer, we do sentinel lymph node biopsy. Surgeon don't remove all the lymph nodes from axilla.
Yeah, just
Uh, yes, and this makes rehabilitation much easier. When it is already third stage and tumor cells are in lymph nodes, so surgeon have to remove the whole
breath.
fat tissue with all the lymph nodes in axilla. And the fourth stage is when tumor cells spread it to some other organs or body
Oh,
parts. Most
okay.
much more often breast cancer. So let's say metastasize. From breast cancer, metastasis go to lungs, bones, liver,
Mm.
brain.
Yeah, the
These are the most
round. And
locations.
yeah, exactly. So, how advanced technology have improved the early detection?
Yes, so first of all, our gold standard mammography improved a lot. Today it's a digital mammography, not films like it was decades ago. Also, we have a huge advantage as
Mm.
tomosynthesis, which is mm, mammography but done in thin slices. So also this masking effect of normal tissue, we remove it with tomosynthesis because we do thin slices and we a bit remove normal tissue and we can identify cancer signs on images.
The abnormal.
Also, last few years, we started to use contrast enhancement. We do mammography with contrast enhancement, which also as MRI. In some places where MRI is not available, contrast enhanced mammography is a very good option because it increases sensitivity of the method. Because cancer, it also differs from normal tissue because it has much more blood vessels. So that's
Oh,
why adding contrast to our imaging modality, if it is mammogram or MRI, so adding contrast enhancement helps us to see areas which has high vascularity. And high vascularity for us is very suspicious because usually cancer has this high vascularity.
okay. And what are the treatments available for the woman according to the stages of
Yes,
this
so
cancer?
nowadays, yes, the most effective treatment is combination of few methods. First is surgery, so removing the tumor. If it
Mhm.
is small tumor, it can be just a lumpectomy or breast conserving surgery, or if it is a big tumor or tumor consists of few parts, we call it multifocal tumor, then it should be mastectomy when the complete breast is removed.
Mm.
Then we have, when, again, let's repeat, along with tumor, also lymph nodes should be removed, and
Mhm.
amount of lymph nodes will depend on the stage.
Of this stage.
Then the second thing is systemic therapy. It can be chemotherapy or targeted therapy or hormonal therapy. Targeted therapy, it is something that uh, we say it was a revolution in oncology. So now we have some medicines that affect specific cancer cells, but not healthy tissue. Yes, and now it's called targeted therapy because it
Okay.
targets only cancer. Uh,
It's
as you know, chemotherapy targets all rapidly proliferating cells. It can be not only cancer but also bone marrow, hair
yeah.
follicles, for example. Everyone knows. Yeah, and that's why chemotherapy has a lot of side effects. Uh, Targeted therapy doesn't have so much side effects, and it is very precise. It attacks only cancer cells. And
On
so, yeah, and for some types of cancers, we also use hormone therapy. So those tumors that have hormone receptors on it, they grow faster because of estrogen and progesterone presence. So hormonal therapy blocks these hormones or blocks these receptors. So this stops cancer growth.
Okay. So, is there a possibility to choose? I mean, the doctors, how they choose the effective treatment for the patient. You mentioned the targeted
Okay.
therapy, hormone therapy,
Yes,
the
yes,
chemo.
this is a brilliant question. So that's why biopsy is so important for us. Today we do biopsy not just to verify is it cancer or no, but also to determine which type of breast cancer it is, because breast cancer is just one common name for at least four different tumors.
Okay.
uh, yes, and for example, two women with breast cancer, they can have absolutely different types of tumors, and they will receive absolutely different treatment. So biopsy first of all shows us what treatment this lady will need, systemic treatment, either it will be hormonal or targeted therapy or chemotherapy. And the second thing, if on the biopsy we don't see invasion, this means that lady doesn't need chemotherapy. And also,
Okay.
if, for example, if it is stage 0 and surgeon removes this in situ tumor, final pathology also doesn't find invasion, which means it again stays stage 0, because after surgery, after final pathology, sometimes we upgrade the stage.
Okay.
And after final pathology, if it is still stage 0, then this lady doesn't need chemotherapies. After surgery, she will just have radiation. And if this tumor had hormonal um, receptors, she will also
Receptors,
receive, yes, she will also receive hormone therapy.
hormone
And she
therapy.
will not suffer from side effects of chemotherapy, which is a good
Exactly.
thing.
Okay. So
And
there is no way to avoid the chemotherapy because we heard that the chemotherapy is affecting also, like what you said, with the side effect, other organs of the body during the
yes,
treatment.
so good thing today is that now we can avoid chemotherapy. And for some patients, we don't use it anymore. And
Okay.
for example, for if biopsy shows that tumor doesn't have hormonal receptors, we 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 call these tumors triple negative cancers.
Triple.
So for
Okay.
them, uh, oh no, sorry, if it doesn't have hormone receptors, but it has each HER2 receptors. So this type of cancer is very effective for Herceptin treatment, this targeted therapy.
Okay.
Targeted therapy, if we find on tumor specific types of receptors, we use this targeted treatment
It's
now
targeted, yeah, because you know which kind of
of
let's say
receptors.
tumor
Yes,
or
we need to
receptors you
attack.
have, and you have to.
Exactly.
Okay, so it depends exactly. It depends on the type of the tumor, the receptors, and everything. So it's not something
Yeah.
that we can choose.
Yes.
So what we
And also
mentioned.
nowadays, after biopsy, we also can find candidates for immunotherapy. So immunotherapy is also something very new in oncology.
Mhm.
It is very effective not only for breast cancer but for many other types of cancers, and it shows very good results.
Okay, and what is it? This immunotherapy? I mean, just in
Immunotherapy, it is a special type of therapy where we teach our own immune cells to attack tumor. So we show them how tumor looks like, and our own immune system starts to attack it.
Attack. Okay.
Normally, how cancer develops. In our body we have some immune mechanisms that
Mm.
every day, every minute, kill single cancer cells in our body. You know, now
Exactly.
while we are talking, in our bodies single cancer cells appear. Do you know that?
Exactly. Yeah.
Yes. So
And
our immune system attacks these single cancer cells and kills. But how tumor develops, for some reasons, these cancer cells, they learn to escape from our immunity. And
exactly.
treatment, it learns again to see, to identify, and to kill cancer cells.
Cancer cells, exactly. So when they don't catch them, let's say when they don't catch them, so they are passing through, and this is how
Mhm.
the cancer is. And how doctor we can assess the effectiveness of the treatment, how the
Okay, yes,
patient
this
can
is
know.
also rather personalized moment. Well, as I said, treatment is very personalized, and effectiveness of treatment is also personalized because every woman, every woman has a different breast composition. Some women are good candidates for mammography only, but for some women we need MRI, for example. So also assessment of treatment effectiveness will depend on lady's anatomy. If she has only fat tissue in her breast, so we can see well on mammography only how tumor responds, how it
Question.
shrinks and even disappears. But if lady is a candidate for MRI, she has dense breast tissue and she has cancer. So again, for treatment assessment for her, MRI will be the best. For lymph nodes, very sensitive method is ultrasound, by the way. This is another advantage of ultrasound. We can see lymph nodes clearly on ultrasound and also see if they are involved in cancer process or no.
Okay, so and the effectiveness, so we can see that this tumor of the cancer is shrinking.
Yes, during the treatment, usually after 1 or 2 months from
Mhm.
starting treatment, we check. We again do either mammogram or MRI or ultrasound to see if tumor responses on the treatment. Sometimes we see that tumor is not responsive and it is even bigger after
Good.
2 or 3 months. This is the reason to change scheme of therapy. That's why
Okay.
very important not to like find tumor initially, but also to check how it responds on the treatment.
On the treatment. Yeah,
Mhm.
thank you. So we still have like 10 to 12 minutes to finish, and we didn't see the time. It's flying. We still
Mhm.
have to talk about 2 points. So if we want to cover this point just quickly, what
Mhm.
is the typical after treatment follow up that the patient has to do?
Yes. So survivorship begins after treatment ends, but it's not the end of the journey. Lady who had breast cancer, she still has high risk of recurrence. So that's why she also needs regular checkups. During the first 2 years after treatment, she needs to check her breast every 6 months.
Every
And
6 months.
after 2 years, it should be done annually. Also, in follow-up care, we use managing of side effects and rehabilitation because sometimes after surgery, after systemic treatment or radiotherapy, uh, women may have side effects. So, like lymphedema, fatigue, or hormonal changes. And it is
Yeah.
also something that should be managed during follow up care. Also, in I notice in very good hospitals and oncology departments, they have special mental support
Mm.
therapies. And they have
Yes,
special staff in their team, specialists, psychologists, who support ladies with their emotional challenges.
due to the
For
emotional challenge.
example, ladies can develop anxiety and depression after breast cancer treatment. And at this moment, she needs psychology or sometimes even psychiatrist.
Yeah, it depends on how, or sometimes having counseling or coaching also with that, which is good. Which this bring us to the next point, which is the mental health and the mental support. So you mentioned that in some hospitals they have this support for the women, let's say for the ladies
Mhm.
after the treatment. And you mentioned at the beginning that women they have sometimes this shock and denial. So have you seen in your experience? I mean, in your experience, uh, how the support, how the mental support could be when it's present, helping this woman during the time when she knows or she discovered that she has the breast cancer.
Yes, I believe mental support and emotional support is very important. I would say vital because, for example, when lady gets this first shock from her diagnosis, we also follow up these ladies. We ask her, for example, after this consultation, where does she go? If she goes at home, who will be there at home? Is there anyone she can talk to who can support her? Because sometimes it can be such a uh, impactful moment, and some ladies decide even suicide or
Yeah.
harming themselves. So this thing is very important. I know, from my experience there were some um, very good examples of very supportive family members,
Numbers, yeah.
husbands, kids, siblings, and ladies who have this support around them. They feel much better and they are much more optimistic with their
Exactly,
way
exactly,
for recovery. And
exactly.
yeah, I know not every woman have this like family
Support
connections.
system, support
Yes, in
system,
their lives. And in this case, dedicated people um, are
absolutely.
essential.
Exactly.
Like
So this is,
specialists like you, for example, who can support, who can give advice in not even medical things, but just in lifestyle, how to deal with routine things. This is very important
yeah,
to restore physical and emotional well-being.
emotional well-being. Exactly. So, we have a question of Nadia Bendriwush. She said, "You mentioned, doctor, that our immune system can attack the cancer cell. How we can improve that?"
We can improve it with healthy lifestyle. This is already evidence-based thing. This is like everyone says about healthy lifestyle. Maybe we're already tired of that, but this is the only thing that really works. Supplements, something else, we still don't have evidence, but physical activity, healthy diet, and control of weight, those factors really proven to support our immunity and to reduce cancer risks.
Cancer is exactly, and I can add as a coach working with women dealing with these health issues and with the cancer, the way how we deal with this situation, we deal with the information when we receive it, also can change, can help also in this how to improve. I mean the immune system attacking, you know. So it's very important this mindfulness, practicing the mindfulness and
Yes.
breathing and quieting a little bit this inner voice that it keeps saying all the negative things and all everything that could happen. That might not happen. So it's the way how we treat, I mean, we can overcome also that. It's a way, it's a holistic way to help to overcome also this part. And so, doctor, how can resources like coaching and support group complement the medical journey according to experience? So you mentioned the experience of the lady with the family
They
support.
can help in the way that they really improve quality of life for these ladies, because this diagnosis is very difficult challenge for everyone, and it involves not only medical aspects but also like everyday life
Emotional.
changes. Yes, lady for example who is receiving systemic therapy, she has weakness, she like hair loss for example. Sometimes ladies even don't know what to do after hair loss, where to buy some wigs for example, or ladies after surgery they have less of movements in arms, in heads. And such groups of support can help with exercises for rehabilitation for example, exercises for or massage.
Yes,
um, so
and
I
also
think the emotional side of for such patients is very important. Their mood and let's say optimism is very important for us for doctors, because if patient is very pessimistic, she's depressed, she does not believe in recovery, she's very moody, s- much more often such patients don't have good results. That's what we notice every day.
exactly, exactly. And this is very important. And this is what we want to bring to the patient and to
Yes,
explain that.
and thank
I
you
mean,
for that.
thank you, Dr. Madina. Yeah, I mean, if it's happening, it's okay. There is always a treatment. There is a way how to deal with that. It's not the end of the end of the world, let's say.
Yeah,
Uh, no, we
that's
have
the
to.
start.
And during the support group, as we are conducting some supporting group, the way, I mean, when in the group, when the women are sharing what they are going through, and the other women find the support and find the empowerment in what they are sharing and how they dealt with the situation, also it's very helpful. The way how to just to express themselves, it's very important during this support group.
Absolutely. Yes,
Exactly.
sometimes, yes, I know in such groups, ladies even share how to communicate with their husbands, with their
Husband.
kids. Yeah, and this is
Exactly.
also important for them.
And sometimes some women, they cannot share something with their family, with the close family, husband or kids. So they find the support in these groups where they can share,
Mhm.
they can say the things that with someone who is going through the same thing. So she feels that she's understood. And so this support is very important. And as you mentioned, my last question is have you seen some cases where the lack of the support has a negative impact?
Uh, of course, yes, lack of support leads to bad depression, and such patients they are in a group for suicide even, so sometimes they may pass away just from severe depression. They refuse to eat, to do anything, even to receive treatment, and sometimes they die not from cancer but from the severe depression.
On the severe depression, yeah, and they are not going through this. So I think we could spend hours and hours to talk about the emotional support and about the breast cancer, all the factors and treatment and everything. I think we are at the end of the hour. Thank you very much, Dr. Madina, for sharing your expertise and your insight and for being here with us today and for
Thank
being
you, dear
patient.
Yasmina, for everything you do. Your support and your work is really, really essential for all
Thank you.
breast, not only breast, but just cancer patients. Yes,
cancer
that's
patient.
true.
Thank you very much. And for you who are listening to us and watching us, remember that having a disease or having, as we are talking about breast cancer, it's not the end of the world. There is always an opportunity and possibility to get the treatment. Now that the treatment are improved, the medicine are improved, and with the early stage detection, which is very important,
Early detection saves lives.
it's
Yes.
very, very, very important. So we have to keep doing this checkup and keep continue and not be scared. There is always an option. So thank you very much for being here with us tonight, and see you after 2 weeks in another call. Thank you.
Thank you, dear.
Thank you.